the president has spent the past 24 hours unloading on this migrant caravan, which began its travels as a group of now 8,000. The caravan reached Tapachula, Mexico on Monday, about 1,100 miles from McAllen, Texas, and it continues to trek north towards the southern border. But the Democrats, they want to keep the focus on health care because the polling shows that that is the number one issue on people's mind. And joining us now to try to understand why health care is such an important issue and is on so many people's minds during this upcoming election and beyond is my good friend Dale Bellis, who is the executive director and founder of Liberty HealthShare. Now, myself and my family have been proud members of Liberty HealthShare for, get this, 7 years. It is the best thing we have ever done. You know, all the healthcare debate, we have to debate it and we talk about it and we analyze it for you on the air. But I'm not personally involved in it because my family got out of this a long time ago. We got out of the whole Obamacare, healthcare rat race. And we went to Liberty HealthShare, which the service is phenomenal. This is a great organization where it's different because everybody shares in their own cost of health, those members. And it is growing every day. It is the best kept secret in America. And I urge all of my listeners. Now, if you work for the federal or state or county government and you've got a great health plan, or you work for a big company and they provide it and you do a copay, that's fine. But if you're an independent contractor or you work in the gig economy or you're on a 1099 or you work for a small company like we have and we can't buy the insurance, it would put us out of business, it's too expensive, or you're a business owner, any of those things, then Liberty HealthShare is a phenomenal opportunity for you. And as I said, my family of 3 and I've got a 14-year-old, even on it when he was 7. And it's the greatest plan. It's like paying cash. It's easy to do. The service is great. Everything gets done. They negotiate everything on your behalf. There's no paperwork. There's no paperwork. It's just you pick up the phone. I mean, you send them the stuff. You send them the bill. That's it. And you get all the preemptive care and all that. But you got to check it out. Go to libertyhealthshare.org. Check it out. Ask for a quotation. That's all. You're going to be shocked by it because you're going to say, no, this is too good to be true. There's got to be a catch. There's no catch. Joining us now to help understand what is going on today in healthcare with this debate, Executive Director, founder of Liberty HealthShare, Dale Bellis. Hey, Dale.
It is such a pleasure to be with you, John. Thank you for the invitation.
Yeah, because I'm a true believer, Dale. When you believe in something, it's really easy to talk about it because I'm not only a believer, I'm a customer, and I have been for a very long time. And we wouldn't trade it for anything. You know, the other day, if I got somebody that just came to me and said, hey, join our whatever it is, organized care, Humana or something, pay $200,000, I wouldn't do it because it's a hassle. LHS.
And in addition to that, we band together, as you've just said, to pay each other's medical bills on the basis of our shared values and beliefs, but we also stimulate one another to lead healthy lives. The reason why there's such dissatisfaction in America about health care today, and that's why it's at the top of people's discussion list and concern list as we come into this midterm election, is because we don't have a health care system in America, John. We have a sick care system. The only time a doctor will see you is when you're sick. And we've got to change that. And we stimulate one another, encourage each other. We welcome folks with conditions that by just simply adding exercise or diet or control to their lives reverses diabetes and heart disease and high blood pressure, certainly obesity. We help people stop smoking. We're focused on the care of our health. And that's what we've got to get back to and focus on and understand that health care is really about the care of our health, and that's what we're focused on.
Well, you stopped me from smoking. So that's good, Dale, right?
And so I'm pleased as can be, John, because we welcome folks with those conditions. They just have to commit to change their lifestyle. A recent survey came out from 2 days ago from the New York Times that just indicated that obesity is as bad or if not worse than smoking. And if people would simply engage in simple exercise every day, it would change their lives, reduce their weight, and certainly reduce the health risk and profile for the future. And that's what we're doing. We're just simply saying, look, let's take care of our bodies. These are precious gifts. What better could we invest in? Folks set aside money for retirement. They plan their entire lives. Let's make some plans to preserve our health into the future. And that's key.
It is key because, I mean, the whole objective of joining Liberty HealthShare, and all you have to do is get a quotation, is go to libertyhealthshare.org, libertyhealthshare.org. It's all there. Or you can call 855-585-4237, 855-585-4237. You get out of the whole government thing. But the best thing about it is it's a plan to stay healthy. It's not a plan to go there when you're sick. Now, obviously, you become sick. You have problems. We've all had them. I've certainly had them over the 84 months that I've been with the LHS. But the object is to stay healthier, and it permeates your whole family. I mean, it's helped my wife, even my 14-year-old, right, is on a regimen of eating better, and he eats no junk food at all, works out every day, plays baseball, all that stuff. And so you find out, hey, if you do these things, your frequency of visiting doctors goes way down. And that's the object of it, right?
That's the beneficial side effect, is that costs are lower. Our members tell us the share amount that we participate in, either as a single, couple, or family, is 50% or less than what they ordinarily would be paying for a secular third-party pay healthcare system.
Right.
And so it pays off for sure in lower costs. But I have to tell you, John, it arises fundamentally from our shared values. We all believe, you, I, all 40,000 members believe that we're creatures of God. Our bodies are temples, and we have an obligation morally and spiritually to care for our health. And that's what mobilizes the entire movement across America for healthcare sharing.
Dale, how do you play into the debate now about healthcare in America? The national polling and survey numbers are pretty explicit. They're saying that healthcare is the number one issue going into the midterms on people's minds, the number one issue. And you've got Bernie Sanders out there, Senator Sanders from Vermont, basically saying there should be Medicare for all, basically turned the whole thing over to the government. Where does your organization play in that?
Well, number one, thankfully, we are exempt from the Affordable Care Act. So both the mandates and the imposition of fines, we're exempt from. So each of us as members are not under that particular regimen. But we're here to just simply tell America there is a better way. Mm-hmm. Drop out of the third-party pay system that has proven to be so an imposition of costs, rising and skyrocketing expenses, and not really addressing the core issues of healthcare in America, and simply be a cash pay, self-pay patient, joining in with an entire network and community of hundreds of thousands of folks across America and meet your healthcare costs as we do, because it's efficient, it meets the objectives and goals of the care of our health, and it's an outgrowth of the way we want to live our lives.
Dale, can you also address the fact that when you join the SHARE organization, and again, go to libertyhealthshare.org, that when you join it, that there's a procedure where you go for your normal checkups, like there is preventative care, which you don't pay anything for, basically, and you encourage your members to go get the preventative and preemptive care and get the checkups, and you do it in a way that there's no cost at all. Can you explain that?
Sure, as a support and an implementation of our focus on health, we want our members to be sure and have no barriers at all for doing those preventative annual checkups. Do the kinds of tests, and there's a schedule every other year for a PSA or a mammogram or a colonoscopy, but do those preventative checks because we want our members to be focused on their health, not upon their sickness, and we share in those expenses for wellness visits 100% without any out-of-pocket for the individual members as an incentive to give attention to your health.
Can you also explain, Dale, the fact that your organization, like when you go in, it's kind of like paying cash because there's no paperwork to do. You just hand them your card. That's it. But when you get the bill, it's then sent to your organization, your share company, and then it's negotiated down. And for it to be negotiated down, I always think, okay, so the bill that I got was $1,000, but they negotiated down to $625. Well, who's paying the $1,000? Like, how does that just? Can you explain that to me?
The folks that get stuck with that are other self-pay patients or insurance companies because they just simply absorb those costs without fee negotiation or understanding the true costs of health care. Unfortunately, John, there's no place to go for a marketplace that says that particular procedure that you're referencing for $1,000, is that a fair and reasonable price? There's no place to go to assess that or determine that. And so we instead use a baseline. It's Medicare. Doctors and hospitals understand it. And then we add a percentage to it for appreciation and expression of care and support to our doctors, our hospitals, 20, 30, 40%. And we send that check out on behalf of members. 97% of doctors and hospitals accept it gladly and appreciatively because it's fair, it's prompt, and it really eliminates all of the unnecessary administrative overhead that so frequently they have to engage in. The other 3% we just pick up the phone and resolve in a negotiation. But that's been our practice, and it's proven to be successful, and it's reduced costs, frankly, John, by 60% over what is ordinarily billed. You and I and others as members share in 40% of the bill as opposed to the other 60%.
And the other great thing about Liberty HealthShare is that you pick your own doctor. I mean, there's no network. There's no online thing you got to say is this doctor in the network, that doctor in the network, what town are they in? There's none of that. You go to whatever doctor you want. Now, if you're not in the program, if you're not a member of Liberty HealthShare, check it out. Go to libertyhealthshare.org. Just ask for a quotation. You put the information in. If you would prefer to pick up the phone, that's fine too. 855-585-4237. 855-585-4237. You can do that. Same thing as doing it online. But the beauty of this is that once you get in the share system, you're going to love it. You're going to love it. Try it for 6 months. You're going to love it. Here's the other thing. You go to your doctor, you're going to give them the card. They're going to say, what is this? Right? Because not every doctor understands it. Not every office understands it. There's a phone number to call, and this has happened to me with my doctor, Ann's doctor, her gynecologist, Joseph's doctor. The first visit, they got to pick up the phone. They've got to call the share organization. They have a conversation with them on the phone. After that, they love it. Like they love when I go in and I hand them that card because it's easy for them. And then the whole thing becomes so much easier. There's no hassle, Dale.
Well, that's our focus is on the members. They're not only just their experience with health sharing, but the fact that they're sharing with one another because it's the entire membership that accomplishes the significance of our dollars going to another person, and we're using that methodology, John, and paying each other's bills to the extent of $30 million every month, and so it is it's growing like a prairie grass fire as a result.
Let me ask you something, Dale. You founded Liberty HealthShare. Are you having fun?
Oh, I'm having a blast. We're here to change healthcare as we know it and change it for good, and that's what's transpiring family by family across America.
John Fredericks, I'm a true believer of Liberty HealthShare because I've had it. My family's been on it for 7 years. And Dale, when we first went on, we had no choice. I couldn't pay the Obamacare fees. I didn't have the money. And for 90 days, my family had no insurance, all right? It had nothing. And this has been a godsend for our family. And I want to thank you, Dale, for this great organization, your vision behind it, and you've made a major impact on my family. And I want to thank you for that, Dale.
That gives me a great sense of honor and satisfaction and gratitude. And it's back at you, Brother John, because you're a part of this movement. Your money every month is going to another person. And then whenever you have bills, that same group is there to pay yours. And it's that mentality of sharing that truly will transform healthcare in America.
I'm a believer, Dale. LibertyHealthShare.org. Go to LibertyHealthShare.org. Yes, you can call them. 855-585-4237, LibertyHealthShare.org. Just ask for a quotation or fill out the form. It's going to come back, and you're going to think it's a typo. LibertyHealthShare.org. Greatest thing since sliced bread. Dale, thanks for being with us.
John, what a pleasure. Thank you. God bless.